health center emerged when a local family doctor was going to be retiring, and the community was concerned about the potential for access to primary health care. And so a group of people came together and formed a planning committee that did a comprehensive community needs and capacity assessment, submitted a request to the Ministry of Health, and out of that emerged the Woolwich Community Health Center, which is a community-governed model, and again gets to work on the full continuum of treatment all the way to health promotion.
It's a different kind of model, particularly because it marries primary health care and illness prevention, health promotion, community development. So it's a very broad model. It's more than just doctors and nurses taking care of people when they're sick. What I like to tell people is if you are exceptionally well organized, you could make one visit to this center a year and cover the vast majority of your health and well-being needs.
Woolwich Healthy Communities is organizationally separate from the health center, and it emerged at a time when there was a discovery of contamination in the groundwater in Elmira. And there was a health committee formed by the region of Waterloo, and realized the strength of a model that really encourages us to look at the significance of having both a sustainable environment as well as a sustainable economy, and then also the significance of having a society that's rooted in social justice and equity and opportunities. And so the Healthy Communities model is one that you often see those three concentric circles, and when they work well together, then you have a healthy community. And that's what inspired and engaged people. I'm employed by the Woolwich Community Health Center, and the health center allocates some of my staff time for support for Woolwich Healthy Communities. I believe in it passionately, and really grateful for the opportunity to work on it. The Woolwich Healthy Communities Coordinating Committee, it tries to ensure that the group has a strong, has funding available, and the Coordinating Committee has also been instrumental in helping to create a Healthy Communities Month, where we really celebrate the community of Woolwich.
In these rural areas, you very quickly get the feeling when you move to that if you're not going to get it done by volunteers, it's not going to get done. So if you want to get something done, you'd best get on with it.
And there's also the Clean Waterways group, which is a group that's been working for 24 years to try and improve the quality of the drinking water.
We have a very caring community here, and Woolwich Healthy Communities is a good focal point and a hub to keep people coming and get things going for us. This is a project we did in 1998 with the Woolwich Clean Waterways group, and we planted probably 250 trees and shrubs along this farmer's field, and at the time we planted the trees there was nothing there. It was just a flat mud pack, and we planted trees, put up fences, and now you can see that many years later what a beautiful forest we have behind us.
That's really what people are looking for. They're looking for some sense of progress. That there's not necessarily a, aha, here it is, we've arrived, but the feeling that somehow things are getting better.
I had the opportunity to bring together in this role a mix of a nursing background, a social work background, and health promotion background, and it's just been a real opportunity to synthesize those three.
Joy's approach to relationship building is ideal for this kind of work. She's equally comfortable with and equally able to develop comfortable relationships with folks who come from very different backgrounds.
Volunteers can do a lot, but there is nothing quite so helpful to a volunteer organization as having at least one person whose function it is to support that group. There's no doubt in my mind that if it were not for Joy's role in this organization would be floundering at best.
Joy is Healthy Communities, but Joy is just always there for everyone. She does all those little behind-the-scenes details that we might forget. Joy always keeps all the details together and keeps everybody organized, and she's always there. She's not just in the office doing paperwork, she's out on the job doing the work in the field as well.
Joy leads from within and leads from behind. Joy looks for the best in people and recognizes the different skills and strengths that different people bring to, to the challenge of building and maintaining a healthy community.
For Joy, it's more than a job. It's far more than, it really aligns with the sort of core values that she has for herself.
The real privilege in working with Woolwich Healthy Communities and the Health Centre is the people that I get to work with. And the fact that time after time after time, I get to witness the good news stories. I get to witness the ways in which people make a difference with their lives. And then also what the difference that communities make. And I'm just particularly blessed to be working in a community where there are so many people with such passion and commitment.